Welcome to this information session. I'm Tony from OMNI College. In this info session, you'll learn about our Canadian Nursing Review program and how it will train you to be a Canadian nurse so you can immigrate to Canada. The agenda of this info session will start with some information about OMNI College, as well as what it's like in Canada. Then we'll tell you about our admission requirements, to tell you what you need to have in order to qualify for a program. Then we'll go through our admissions process to show you the steps of what you need to do to qualify for the program. Next, I'll show you a timeline and give you an example of what it will look like and the steps to go through to become a Canadian nurse. And after, I'll give you some examples of where OMNI grads are working. And then I'll tell you about the average nursing salaries and what you can expect to get paid when you become a Canadian nurse. And to wrap it up, I'll go through some frequently asked questions to hopefully clarify some unique concerns that you might have. So first, why choose OMNI College? Well, we've been in business for over 20 years. Since 1999, we've specialized in healthcare-related programs, specifically for internationally experienced nurses and educated nurses just like you. We have all the necessary government accreditations. We also have a proven success rate. Over 95% of our students pass their licensing exam on the first try. And over the 20 plus years that we've been in business, we've built a network of Canadian employers who have hired our grads before. And our grads are working as nurses. And because they're nurses, they get to immigrate. And I'll show you that you will, once you get that nursing job, that's how you will be able to qualify for immigration in Canada. And we're also located in the most beautiful city in Canada, and just 15 minutes outside of Vancouver, British Columbia. So just like in many countries around the world, there is a critical nursing shortage in Canada. One of the main reasons for this nursing shortage is due to the generation of baby boomers. Baby boomers is a generation born after World War II, starting from around 1946, born to about 1964, age range of about 57 to 75 years old. In Canada, a nurse can retire at 55 years old. In Canada, the average age of a nurse is about 44 years old. That's average, which means that half of them are older than that, which also means that a large percentage of them are older than 55 years old. That means over the next few years, Canada will lose a large percentage of our nurses to retirement. That is a lot of job opportunities. So I've mentioned our student success rate, and I've mentioned our 20 plus years of being in business and our long track record. So why? One of the main reasons why OMNI is successful and OMNI students are successful is because our program is different and we measure student success differently. Our program is meant not just for you to train you and help you to get your nursing license, but also to make you job ready for the Canadian nursing workforce. And it's much more than just achieving that piece of paper, that license as a nurse. It's much more than that. And we will train you and support you and guide you every step of the way, from the first day we speak to you all the way until you get your nursing job or your second or third nursing job if you tell us. We will guide and support you all the way. So here are some examples of what our grads have to say about their experience at OMNI College. So first, Scott is from the Philippines, and he is currently working as an RN in BC. And he says that OMNI supports us in all aspects in what we need to become a successful Canadian nurse. Just like I mentioned, we will support you every step of the way, all the way to you becoming a licensed working Canadian nurse. Next, Sachiko from Japan She is currently an RN on Vancouver Island. And she says it was not easy, but I was able to achieve it because of OMNI. Again, our support. And many nurses from different countries have different challenges. For example, nurses from countries like Japan or South Korea or China, even though they may be brilliant and experienced nurses, their challenge may mostly be the English requirements because they probably didn't train in English. Whereas nurses from other countries where they did train in English, their challenges will be different. Another example is Anish, and he is originally from India, and he did train in English, but his challenges were different. And so Anish actually started his path and became an LPN first, but then he continued to strive for his RN and achieved his RN, and now holds a managerial role in Manitoba as well. He is also serves as a board member for the nursing regulatory body in Manitoba, and that's a pretty big deal. Another example is Bimpe from Nigeria, and Bimpe says that she says, I got all the support I needed from my arrival at Vancouver Airport to my becoming a registered nurse in Canada. Again, just speaks to how we will guide and support you every step of the way. So what is it like in Canada? So first, as I mentioned earlier, there are a lot of job opportunities for nurses. Now, all the other nurses that you will be studying with at OMNI, you will be competing with none of them. There are plenty of jobs for everyone. You will only be supporting and learning from each other. Now, also, Canada is an immigrant country. We were built on immigration. The Canadian universities aren't able to make enough nurses fast enough, so we rely heavily on foreign nurses like you. And when you become a Canadian nurse and get that Canadian nursing job, Canada wants to keep you. So you will be able to qualify from a number of immigration programs. And also, because Canada relies so heavily on immigration, we are also very multicultural. Everybody comes from someplace else. Canada is very open-minded, accepting, and inclusive. And in Canada, everyone is given basic human rights and is treated equally, fairly, and with respect. Plus, in Canada, nursing is a very well-respected profession. Our healthcare system it's very important to us. And it's the nurses who are the champions of our healthcare system. So they are very well respected in Canada. And along with that level of respect as a nurse in Canada also comes a high level of pay. Nurses get paid quite well in Canada. So your quality of life will also be very good too. Also because it's safe in Canada. We have very strict gun laws and you can feel safe walking the streets at night. And Canada's clean. And as you may know, Canadians are very nice and polite as well. So as mentioned, nursing is a very well-respected profession in Canada. As a matter of fact, Canadians were surveyed on their point of view about professions in Canada, and nursing is the second most respected profession, only by a slim margin, only next to firefighters. And again, with that level of respect comes the high salary. And on the bottom of the screen, you can see the average salary range of salary that a registered nurse earns in 2021. From the low end is $24, median about $38, high end about $48 per hour. However, there are some nurses who earn above $50 per hour, earning over $100,000 per year. And again, these are Canadian dollars. If you're not that familiar with the currency of the Canadian dollar currency, but perhaps you're familiar with the US dollar currency, the Canadian dollar is ranges from about maybe 72 to 75 cents compared to the US dollar. If the Canadian dollar is a little strong, maybe it might get to about 80 cents compared to the US dollar, just to give you an idea. Okay. So now that I've given you some insight on what it's like in Canada, let's go through OMNI's admission requirements. Now, please note OMNI's admission requirements are different than the requirements of the nursing regulatory bodies. Okay, these are just requirements to qualify for our Canadian Nursing Review Program, and these are the minimums that OMNI believes you must have in order to be successful in our program, as well as successful in the Canadian workplace. Okay? The nursing regulatory bodies, those requirements are just what you need to qualify for licensure in that province. Okay, and there are more requirements and processing for your licensure with the nursing regulatory bodies. So for OMNI's admission requirements, here they are. So first, you must be currently registered as an RN, and your registration must be in good standing. And it must be as a registered nurse. Okay. Unfortunately, if you are a licensed practical nurse or even a doctor, I'm sorry, you will not qualify for this program. And your RN experience must be at least 2 years within the past 4 years. Okay, and your 2 years of work experience is asides from your internship in university. Okay, your internship in university does not count. So you must have 2 years within the past 4 years. So your work experience must be current. There is a minimum English requirement of an IELTS academic test, minimum score of 6.5 overall, with no band lower than 6. Again, that's IELTS academic, 6.5 overall, no band lower than 6. Or equivalent test. We will accept cell band test or equivalent. You must also pass OMNI's comprehensive nursing assessment. Our CNA is like our entrance exam. However, if you are actually an experienced nurse, then you don't have to study for this. You don't have to prepare for this. If you are actually a nurse, you will do fine on this. If you are not a nurse, you will not pass this. The next step, then, you would need to pass an interview with an OMNI advisor. The OMNI advisor would probe and ask you a few more questions about your nursing experience and background. As well, you will get a chance to ask the advisor any questions or clarify any concerns that you will have specifically as well. Now, why is it so important for work experience? Why is it so important to get work experience before your arrival? Well, as mentioned, the purpose of this program is not just for you to get that nursing license. The purpose of this program is also and mostly for you to get that nursing job. And if you do not have nursing experience back home, it will be very, very difficult for you to be employed as a Canadian nurse in Canada. The more nursing experience you have back home, the more employable you will be in Canada. So the time and money that you spend gaining experience and saving that experience, that is an investment into your future as a nurse in Canada. So next, let's go through the admissions process and the steps that you need to do to take to qualify for a program. So step 1 is attend OMNI College's online information session. By listening to this recording, you have achieved step 1. Step 2 is to submit our enrollment application form, as well as all required documents and fees as well. You will get a follow-up email from an OMNI advisor that will provide you the form as well as let you know all the requirements and fees to pay. Now, please note, you don't need to pay your application fee or your CNA fee right away. Okay, you can send us some other information and we'll communicate with you by email a little bit and make sure you're the right fit for this program. Make sure that that you qualify for this program, and then we'll let you know when you can pay the fees. Next, you'll get to complete the OMNI's CNA, as mentioned before. And then once you pass that, in step 4, before you have your appointment with an OMNI advisor, first you'll get to complete a pre-admissions interview questionnaire. And what this will do is probe to see how much research you've done about the nursing registration process in Canada. Now, this is very important to ensure that you yourself have done your due diligence and understand how complex this process is. Okay, this is not to make things harder for you, but instead it's to ensure that your expectations are set accurately of what is needed to become a Canadian nurse. So it's very important. And so after you meet with the advisor, then you will receive your conditional letter of acceptance, which will detail all the fees due. And for step 6, you will then pay the tuition fees that are due. That again may consist of tuition, textbooks and materials fees, as well as any other services, perhaps like insurance coverage or arrangements for accommodations. And after, you'll sign and submit your student contract, and then you'll receive your official letter of acceptance. And this LOA is what you will use to apply for your visa and study permit. So next, here are the 3 processes that you will go through to become a Canadian nurse. The first process, your admissions process to OMNI, this is the easiest process of them all. Now, remember, you will get support and guidance from OMNI through all of these processes, okay? We will assist you and guide you. The next process is your nursing registration process. This is the process that you will go through to achieve your nursing license. You will also get guidance and support from OMNI every step of the way to achieve your license. The third process is applying for your visa and your study permit. You will get some guidance from OMNI for this process. However, please note that we are limited to how much support we can give you because we are not an officially certified immigration consultant. So we will be able to just provide you guidance on the links and the guides on the website to know how to apply for the study permit application. But if you would like to pay for the services of an immigration consultant, we would be able to refer you to an RCIC who can assist you with that. Now, at the bottom of this screen, please note these 3 websites that you can go to start doing research on these 3 processes. The first one, cellbancenter.ca. This is regarding the CELBAN test, which is an alternative to the IELTS test. So you can use the CELBAN test instead of the IELTS test to qualify for admissions to OMNI, as well as qualifying for your nursing registration in Canada. Okay, so go to cellbancenter.ca if you want to learn more about the test, if you want to also see what kind of test dates are available, things like that. Then the next website is the nnas.ca, the National Nursing Assessment Service. This is where you will start your application for your nursing registration. However, please do not start your account, pay the fees, and start your application yet. You can start your research. You can go there to read about the requirements and the steps and process, but do not submit any fees or start your application yet until after your visa and study permit has been granted. And to start that process, please go to the Canada Immigration website, where you can see the steps and processes and requirements and forms that are needed to apply for a visa and study permit from your country. Next, here is a visual timeline of the steps that some people go through, that you may go through to become a nurse in Canada. Now, it's different for everybody. It depends on whether you are becoming an LPN first, as well as what province you are applying to in Canada. Now, we understand that this process is very complicated and can be overwhelming too. That's why we are here. We have been supporting IENs like you through these processes for over 20 years. We are the most knowledgeable and have the longest history supporting IENs in Canada. As I mentioned, we will guide and support you every step of the way from the first day we speak to you until you get your nursing job. And now, another thing that's very important to research and consider when planning your timeline are the differences in nursing registration processes and requirements in each province. The two most common and significant requirements that may be different from between provinces are the English language requirements as well as the nursing competency assessment. Those two steps can severely impact your timeline to becoming a nurse, depending on which province you choose. So as we go through this timeline, please make note of where you may be able to save time. So first, let's start at step one of when you would get your visa approved. And it would be your visa as well as your study permit that would be approved. And then, as mentioned, after that, that's when you would open your NNAS account. And you would be able to pay the fee as well as have all your documents submitted. And after, you would arrive in Canada and start to settle into life in Canada. Shortly after, you would start your program at OMNI in the Canadian Nursing Review Program. And hopefully shortly after that, you would receive your advisory report from the NNAS. And this is the report that would be advising you what requirements that you need to fulfill to qualify for the provincial regulatory body that you have chosen. And after that, you would receive eligibility from your chosen provincial regulatory body to complete the competency assessment. Now, again, remember, this is one of those steps that may be different for you, depending on what province you are applying to. Depending on the province, you may not even need to complete this step. But if you do, after completing it, after completing the competency assessment in step 7, afterwards, you would complete any transitional coursework. That would be the requirements as a result of the competency assessment. And so again, these would come in the form of doing any remediation or transitional courses required by your provincial regulatory body. And after you complete all those requirements and all those transitional courses, then step 9, you would receive eligibility to write your nurse licensing exam. And after you pass the licensing exam, shortly after you would receive your nursing license. And in some provinces, before you get your permanent nursing license, you may get a provisional nursing license first. If that is the case, you may also begin your co-op work experience module in step 11 with your provisional license. And then after you finish your co-op work experience module is the final module of the program called Leadership in Nursing. And this is a short module that you complete with your employer based on the work you did during your co-op. Now, here's a little more information about your co-op work experience module. So all students of the Canadian Nursing Review Program must complete the co-op work experience module. It is an integral and essential part of this program. This is also the second last step of the program at OMNI. And you can begin this program, as mentioned, on either your provisional license or your full or permanent license, depending on which province you apply to. And the co-op work experience module, you have up to 4 months to complete a minimum of 250 hours of work as an RN, of work as a nurse. either LPN or RN, minimum 250 hours. If your job is a full-time job, then it may only take you about 6 weeks or so, but maybe the nursing job you have is part-time or casual, so it takes you longer. That's why we give you up to 4 months. Now, please note this co-op module is different than your internship that you did during university, because OMNI is not a big public university. We don't have thousands of students, and we also don't have a hospital on campus. However, as mentioned, we have a very large network of Canadian employers, so you would be able to get placement from one of those employers. Previous grads, previous employers of our grads are calling us every day, asking us for more nurses. They want to hire more OMNI nurses. And once you finish this component, as mentioned, then you will complete the final module of the program, which is the Leadership in Nursing module, where you'll complete the assessment forms with your employer based on the co-op module. Now, here is a visual idea of where our grads are working. Now, although most of our grads are working in the provinces that are shaded in purple and light purple, because those are the English-speaking provinces. However, in the province of Quebec, we do have, I believe, 2 grads working there. They came from countries where they trained in French and worked in French. However, they completed our program in English, but then passed the licensing process and achieved their license in French in Quebec. And we also have a student working up north in the Northwest Territories. And we thought he was only going to stay there for about a year or so. But he is making so much money up there, earning over $120,000 per year up there. Because in the Northern Territories, they are even more desperate for nurses than in the other provinces. But this gives you an idea of where our grads are working, and it's in every province. We're not just in BC, where we are, all the provinces in the middle, as well as far east in the Atlantic provinces in the Maritimes. Now here's a more clear and specific breakdown of the nursing salaries in each province in Canada. I've only given the statistics for the English-speaking provinces of where most of our students end up, but please note how there is quite a range in salaries, okay? And one of the factors in the range may be simply cost of living. For example, in Vancouver, British Columbia, where Vancouver is one of the most expensive cities to live in the world. And you can see the high range of the salary there is $46 per hour. But compared to, for example, a place like Nova Scotia, the bottom of the list, where it's only $42 per hour. However, in Nova Scotia, the cost of living is much, much lower. So although the salary is a little lower, the cost of living is way lower, so you would actually be saving a lot more money as well. So it depends on you and your goals. And so you can get an idea of the ranges of salaries per province. Next, here are a couple lists of the nursing regulatory bodies in Canada per province. Now, please note that many provinces have a nursing regulatory body for registered nurses separate from a regulatory body than licensed practical nurses. But there are some provinces that have one regulatory body for both RNs and LPNs. Okay. Now, if you would like to do more research onto the website of a provincial regulatory body of a province you have in mind, you can simply go to Google and type in the words nursing regulatory body and then the province you're looking for. And that will pull up the website of that regulatory body that you can start doing research on. Next, after this information session, please feel free to reach out to one of our overseas coordinators or admissions advisors. They'd be able to provide you next steps on what to do, as well as provide you all the forms and requirements that you need to submit to qualify. Now, first, if you are in the India area, please feel free to reach out to Dilsha. She's in Bangalore. Please make note of her email address and phone number. And Dilsha has been with OMNI for years, as a matter of fact, and has been to OMNI campus in Canada twice. And Dilsha would be able to give you a really good point of view and feeling, even, of what it's like to be here. Next, we have Kevin in Nairobi, Kenya. Now, Kevin services not just Kenya, but all of Africa, in fact. So if you are in Africa, please feel free to reach out to Kevin there. And there's his email address and his phone number. Kevin as well has been with OMNI for years and has also been to OMNI campus in Canada. So he would also be able to give you a very good feeling of what it's like to be here. And next is Philip. Philip is in Vancouver, Canada. He's here on campus and here in Vancouver. If you are in another region aside from Africa and India, please feel free to reach out to us. We have Philip speaks to nurses from all over the world, from the Philippines, from South Korea, Japan, China, Brazil, everywhere. So please make note of Philip's email address and his phone number. Please feel free to reach out to any of our advisors or OCs, and they would be able to give you next steps. And again, as mentioned, you don't need to rush out and pay the app fees and CNA fees right away, okay? Speak to our advisors first so they can ensure that this program is the right fit for you, okay? And then they will let you know when you can pay the fees, okay? So please feel free to reach out to them. Next, what is it like at OMNI College? Well, OMNI College was founded by an RN, Ron Burke. Ron is my father. We are a family-run business. However, the term family applies to more than just the Burkes, and it also goes beyond the faculty as well. In fact, it was our students who told us that OMNI is their family away from home. The OMNI faculty and students alike, we become the family that you depend on throughout your journey in Canada. Now, please note, becoming a Canadian nurse is not easy. It's difficult and it's complicated. If anybody tells you it's easy, I'm sorry to say to you, but they're lying. Okay. But when you are at OMNI, you will get the support that you need. You will get to form special bonds with your classmates as you support each other, not compete with each other, support each other to success, to becoming Canadian nurses. And we celebrate. We celebrate Canadian holidays together. For example, at Christmas time, the faculty gets together and we cook and prepare Christmas dinner and serve Christmas dinner to all our students. And we all gather together and celebrate at all of the Canadian holidays. We also celebrate our student successes, very importantly. For example, when you pass your English requirements, we will celebrate. Or you successfully complete your nursing competency assessments. Or when you pass your licensing exam, we celebrate. We will celebrate those successes with you. In fact, very often, grads will come back to OMNI campus with a cake for the faculty to say thank you. We will eat a lot of cake. But again, this process is not a piece of cake. But we look forward to sharing some cake with you. So next, let's get into some common, frequently asked questions to again clarify some specific concerns that you might have. So first, very common question we have is, can I work during my studies? Yes, you can. When you come to Canada, if you are coming on a study permit, that study permit allows you to work part-time during your studies up to 20 hours per week. Okay. Next common question is, do OMNI students get a post-grad work permit? And the answer to that question is no, they don't. And the reason why is because they don't need one. Post-grad work permits are for schools and for students of that schools where that need a post-grad work permit in order to stay in Canada longer, so that hopefully they can build up enough points for their application for immigration to hopefully qualify for permanent residency. But unless they choose the right profession and have the enough points, it's very difficult to achieve permanent residency that way. However, our OMNI students, OMNI students actually become a nurse. As you'll note from the timeline that I went through, you will be licensed and working as a nurse before you graduate from this program. So you will be licensed and working as a nurse while you are still under status of a study permit. So, and once you become that nurse, once you get that nursing job, as I mentioned before, you will be able to apply for permanent residency. Canada wants to keep you. So as far as I know, any province across Canada, there are immigration programs that favor nurses that you would be able to qualify for. So that's why OMNI students, OMNI nurses, don't need a post-grad work permit. Another question that is commonly asked is, can I bring my family? And this is a bit of a difficult question to answer because very often the answer is not what some people want to hear. Because truthfully, the answer is you can, but you shouldn't. Well, first of all, when you apply for your study permit, if you are trying to apply for a visas for your family to come with you, chances are your visa application, your study permit application will not be granted. It will probably be rejected. Because the reason why you're coming to Canada is to study. That's your main focus. And as I mentioned, becoming a nurse in Canada, it's hard. So you need to focus on your studies. And as much as your family loves you, they will be a distraction. Unfortunately, you don't need to be cleaning up after and making dinner for your spouse. You need to be focusing on your studies. You need to be focusing long-term on becoming a nurse. So it's better, much better, for you to come first by yourself, achieve success, settle into Canada, and then it will be much easier to bring the rest of your family afterwards. Another common question is there an age restriction? This also is a complicated answer to give because it's not a very straightforward answer, because we want to ensure that you will be successful. In fact, we will only accept you if we are sure you will be successful. And that means successful means becoming a Canadian nurse as well as immigrating to Canada as well. And when it comes to immigrating to Canada, for many immigration programs, age is a category that you gain points for. And after a certain age, you don't gain any more points, which can severely impact your chances of gaining permanent residency. But also gaining employment after you are a certain age can also be difficult. So if you are concerned about your age, for example, if you are above 40, when you speak to an OMNI advisor, please let us know your age, and the advisor will speak with you and probe with you a little more about what your specific goals are. And then the advisor will be able to provide you some insight and make sure that we set your expectations accurately of your chances for success in Canada. Okay, because it's very important that you know what you are getting into. And if you still want to at that point as well. Okay, very important point of when you will need to make that decision. And lastly, the last question I want to review is why are English requirements necessary? And this is a great question because, as mentioned, many of you studied in English and may even work as a nurse in English. Well, in Canada, because as I mentioned, everybody is from everywhere else, and everybody's accents are very different too. So chances are that your patients are going to have accents that you may have never heard before. Also, employers want to know that you have a high enough level of understanding of English that you are going to be safely and effectively communicate with your patients. But also, the level of admission requirement that OMNI requires, that is the level of English that we know you need to have in order to be successful in our program, in this program, as well as what you need to be successful in a Canadian workplace. So that is why we have those English requirements there. But again, please note, different provincial regulatory bodies have different English requirements. Okay, so even though after you pass on these English requirements, that may be the only one, the last English requirement you need to achieve. Perhaps, again, depends on the province you are applying to. Now, if you have any other questions that you would like clarified, aside from these ones that are mentioned here, please feel free to reach out to any of our advisors or overseas coordinators that are listed there, or go to our website, omnicollege.com. And then you can simply scroll down on the website until you see the button, See If You Qualify. Then click on the See If You Qualify button, answer 3 very quick questions, and then you will get to be connected with an advisor that will then answer your questions, provide you more information and next steps. So again, thank you very much for attending this information session. Please feel free to follow us in all your favorite social media. We do lots of posts and updates on social media on all things OMNI, but also on the nursing industry in Canada as well as globally as well. So please follow us on social media. Again, thank you very much for attending, and I look forward to meeting you in Canada. Have a great day.